before the foot or leg repair?
Absolutely. The sooner we treat the patient, there's a more chance that the patient will recover. And as we can take patients at any stage, from beginning of a problem when the patient starts developing, let's say, wound or leg pain, and we can take through all the stages until the patient has a gangrene and bone infection and severe leg pain. And we can treat at any stage, but sooner we have a patient in our office, we can give him a better chance to recover. Obviously, when the patient comes too late, nobody can help the patient. But we did help quite a few patients who had supposed to have a leg amputation, and we have documentation of hundreds of patients who were saved this way. Now, as far as are there any side effects or any complications of treatment, the only contraindication to treatment is possibly if somebody has a deep vein thrombosis, means clot in the veins in the legs. These patients cannot be treated. Otherwise, there's no contraindication. The treatment is painless, it's comfortable, it's there's no unusual discomfort. The patient is sitting in a chair or on a table for about 45 minutes to an hour and can watch television, read a book, or maybe take a nap. And as I say, there's no other complications or no other contraindications.
Is there any pressure put on the heart by the?
Okay, the heart heart function is improving. When we treat the patient, the heart is not only is neutral, but the heart function is improving because we take the pressure from the heart. The heart is pumping against the lower pressure, and at the same time gets more blood inside the heart. Means when we are relaxing, when the heart is contracting, then there's less pressure. The heart is pumping against the lower pressure. And when we are contracting, when the heart is relaxed, more blood goes back to the heart. So the heart gets filled with more blood, but is contracting with a lesser force. The heart is able to function in a better way. So, for example, if somebody has angina, if somebody has a chest pains, we can eliminate angina because the heart does not have to produce as much strength, force to pump, and is using less energy, less oxygen, and angina may go away. So it's a beneficial treatment as far as the heart is concerned. You can compare it if you run a marathon, and somebody will say now after let's say 5 miles you can sit down and rest for half an hour and then continue running. You'll be probably running a little bit more refreshed. Same is here. If you are treated with a circulator boot, it's like giving your heart a break. The heart is getting rest.
So with less pressure being put on the heart, the circulation throughout the body actually becomes better.
Yes, you can say the circulation is better, although the main treatment principle is producing new blood vessels and recanalizing or reopening the blood vessels which are already closed by blood clots or by cholesterol debris or some other conditions. We have a great success in treatment of what we call a cholesterol embolization syndrome. Many times when the patients have a cardiac catheterization or when they have a heart surgery or some other procedures on the blood vessels, the stimulation of the arteries may cause a shower of cholesterol emboli going down the stream and block the small arteries in the toes. And these patients develop black toes, which in the past they will always qualify for amputation. These days, with a circulator boot, we can recover probably 80 to 90% of these patients, preserve their toes. So that's another research that we recently published which is demonstrating that we can recover this patient's legs.
So by increasing the circulation, you increase the healing and the blood to the extremities, therefore helping nature fix the problem.
Well, it's definitely what is important when you look at this, comparing to all available other treatments. Everybody else is addressing a palliative care, means a temporary improvement. Surgery, for example, when you use a stent, it reopens artery, but it does not stop other arteries from deterioration. Same is with angioplasty, same is with a bypass. It's like putting a band-aid on a problem. In our case, we are addressing the principal cause of a problem, means by improving the blood flow and generating new arteries and improving the quality of blood vessels, we are able to restore the conditions of the circulation, and means we are going back to 10, 20 years of age taking away from the patient. It's like regeneration, the blood vessels. So we are addressing the principal problems rather than putting a band-aid on whatever the patient has.
You want to talk about how it's non-invasive in a little more detail?
Yeah, but the treatment is non-invasive, means that we are not injecting anything into the body, we are not causing any additional harm to the patient, we don't cause any pain. The treatment is through application of outside pressure on the leg and on the arteries, which is very gentle. It's a very small amount of pressure. It's comparable to a handshake, and the patients usually enjoy this treatment because they can spend time maybe watching television and so on. But it's totally is not involving any kind of a surgical invasive treatment.
Good. I'd like to get in this